this is a really cool case study. And, you know, as we talked, we spoke about informed investing and capturing opportunity. But something that's sometimes overlooked is the elimination of risk. How do we eliminate risk in making mistakes? And you know what? A market assessment study is oftentimes a great tool and resource to use to eliminate risk. So in this particular case study, our hospital client was considering building a new outpatient center in a tertiary care area, which can be challenging. I mean, most of your work, as you hospital professionals know, come from your primary, your PSA or primary service area, with some additional coming out of the secondary service area. However, with the expansion of retail pharmacy and how what it's doing to traditional hospital care, hospitals need to go out and expand sometimes out of their primary and secondary service areas. So some quick facts before we get into the details of the research. Senior leadership assumed that consumers would use the new facility because of the health system's brand, that it was well known and trusted. However, a specific geographic location was not identified, and therefore our hospital client was unsure where to build the new center. So just to review again our question. So what was our question? As I stated, will consumers use our new outpatient center? So as in the old Field of Dreams quote, if we build it, will they come? That was the question, okay? So what we did, we embarked on CMA, and we conducted the CMA to assess the feasibility of the project and consumers' likelihood to use our client's new outpatient center versus existing competition. So we have some fun stuff now for the audience to participate in. We're going to put up a quick poll, and we want to know from you what you think the outcome was of this research. Take your time, read the question, and look at the 4 answer options that are in front of you. So as you read the question, take your time, answer, read each response, and let us know what you think the outcome was. A couple more seconds here. Interesting. So we have some geniuses here today. 75% indicated that, yes, it was well known, but consumers are unlikely to switch from their current provider. That is the correct response. So let's take you through what we did. So like I said, we spoke to consumers about the likelihood of using the outpatient center. And surprisingly, there would not be a shift just because of the name to our client's center, because other centers were already entrenched in the marketplace, and obviously consumers were satisfied with the services that they were receiving. So now I'm going to hand it over to Mike to inform us of what they actually did with the knowledge they obtained from the market research.
Thanks, Joe. You know, it's funny, you know, what Joe was saying, that this is a study, let me put it the way I'm thinking, this is a study that senior leadership wasn't exactly real excited about the results. I mean, the results were what they needed to hear, but what they felt is what all of you kind of scored in the survey, that we might not be well known, but they're going to come because we're going to be able to get them there. Or they thought we were so well known that it was a no-brainer. But you know what, as Joe displayed on the previous slide, we weren't well known out there. So to open a center out there based on the services that we wanted to offer would have been a terrible investment, because 3 months in, the first words that would have come out of the physician leadership and the administrative team at this particular hospital would have been, why aren't we marketing more? Why aren't we advertising more? No one's coming in. We had no brand equity out there. We could have invested $200,000, $300,000, $400,000 in marketing dollars, and it probably wouldn't have made a difference because a competitor had a good position out there. We had no brand awareness. So, it's almost like we had to build the brand awareness if we thought we needed to open up this center and then open up the center. So it was a great study that allowed us to say, listen, let's step back. Let's listen to what consumers are saying in a given marketplace, because they're the ones that are coming in. Oh, and by the way, you have no medical network out there. We didn't have a primary care base out there. We didn't have an OBGYN base out there or a pediatric base out there. So it wasn't like we could go out to the docs and say, listen, we're opening a center out here, refer your cases to us. We had to go direct to consumer with no brand equity. So basically, it was extremely expensive to even think about going down this road. So a message that senior leadership and the medical staff maybe didn't want to hear because they didn't feel that way. But when they saw the numbers and they saw the results of the research and they began to understand what it would take in terms of a marketing strategy to drive business into this center, obviously the hospital under the umbrella of the health system backed away and said we're not going to do this, which was a good business decision. But again, it was the type of message that they really didn't want to hear, but it was the type of message they had to hear, and they embraced it. I'll just wrap by saying, if you look at all three of these studies, both from a large outpatient center to expanding strategically, creatively, and in a good way, women's services, and not opening a center. All good research, all presented to senior leadership in the C-suite in a way that, one, they understand it, but two, it drives home the point of what we need to do from a business development perspective. So that's what I always felt with research is I don't know how you go into the C-suite, and I know the challenge is how do we fund it and this and that, but I don't know how you go into the C-suite with a strategy without having some sort of research behind you to show what could or could not happen if you go with this particular program based on what consumers are telling you. So this might have been a message the senior leadership didn't want to hear. They needed to hear it, and they made the right business decision of not opening the center out in this particular geographical area.